Thank you all for inviting me to this community-driven session as a healthcare representative. My names are Kamana Masambo, though I'm known as Sister Annie, because in our setups, usually we are called sisters as nursing care nurses in our country. I work at the University Teaching Hospital in Lusaka as a caregiver, and I've been working under hepatitis B programs for more than 10 years. I'm a registered nurse, and as a nurse, I've seen that there's a lot that we need to do in our country to sensitize our communities and even my fellow health workers. Because hepatitis B, most of our patients come in without showing any signs and symptoms. So for them to be told that you have hepatitis B, it's really a challenge to them and their families. And us being health workers, we've learned about these things, about the infection, about prevention, and about treatment in schools. But practically, we really we need more time to be sensitized and more on the community, so that the community also, they are aware how this hepatitis B comes in. Because since it does not show any signs and symptoms, once we test them for hepatitis B and the tests come out positive, the patients would really pass through challenges of not accepting the results of the test. So what we've done as health workers, we have set up some programs so that these programs are integrated in ARTs. What we usually do is when the patients come, we sensitize them on the signs and symptoms and prevention, then on the treatment. So as part of my job, I usually go out in the communities. In the communities, we sensitize the communities on how they can prevent their families. Because in Zambia, hepatitis B has affected almost about 6% of our population in the adults, and in children, it's 1%. We have less patients who are hepatitis C positive. So our key objectives for this hepatitis B programs in our country is, as I've already said, that most of our health workers, they have to be sensitized on hepatitis B testings, and they have to be sensitized on vaccinations, because most of our health workers, they are not vaccinated. So we are just advocating for more preventive measures on our patients and even on the health workers. So we are also focusing on providing information to our mothers, because on a daily basis, we receive cases from our antenatal clinics for mothers who are positive. So these mothers usually come in when you sensitize them on hepatitis B information. Most of them, they turn out to be ignorant about this infection. So what we are advocating for is these mothers should be sensitized more. If health workers are impacted with the knowledge about this hepatitis B, it will be easy for antenatal mothers also to be impacted, so that they are aware of the infection and how to prevent their babies from getting the hepatitis B virus infection. And in these clinics, usually, the other challenge that we have is the birth dose for their babies. These mothers, when they are given, usually we give them prescriptions so that they would buy the prescriptions for their babies at birth. Now, mostly in our country, this birth dose is very expensive. It costs about $150 or $200. So these mothers, they would opt to be on treatment so that they prevent their babies from getting infection, of which since they don't have enough information about this hepatitis B. So what we usually do is there are some cases that we would have the prescriptions to them so that they will go and buy from the private clinics, because usually in the hospitals or in the institutions, we don't have these birth doses. But for the children, as they go for their under 5 clinics, they are usually given the hepatitis B vaccine that is starting at 2 months and upwards. And then the other thing is our mothers have is that for them, when they are pregnant, when they come from the antenatal clinics, they usually have, because for them to be started on treatment so that we prevent the babies from getting the infection, they have first to be tested for these other parameters, but you find that our mothers they cannot access the testing of the baseline so that they are put on treatment, so that there is prevention of mother to child. But these services or these reagents for us to protect, to give to our mothers so that the babies are protected, these reagents are usually not so accessible. They usually go to the private clinics, of which it still comes to the cost effectiveness. They are expensive. They are around $200 to $250 for them to go and test for these other parameters for them to start the treatment. And we find that mostly our mothers, they would want to be commenced on this treatment so that they prevent their children from getting the virus, of which in hepatitis B programs, we have to know the parameters of their readings before they can be commenced on these treatments so that the baby is prevented from getting the virus at birth. So for us to achieve these objectives in our program, we really need to sensitize most of our health workers and sensitize these families in the community that are positive, because we have to include all the families. Like for those who are positive, we include all the family members for them to be tested. I can give my experience as I've been taking care of these 1,000 patients who are hepatitis B positive. We have families that I can give an example, there are 7 or 8. When one of them falls sick or dies, we go to test that family, or they are referred to our clinic. When they are tested, you find that the whole family, maybe of 7, there will be 4 or 5 who are positive, 2 are negative, of which it is a challenge for us to go and sensitize them in the community so that they are really aware how they can prevent this hepatitis B infection. But as I said, most of our challenges are accessibility to the testing reagents and to the vaccinations. Most of our health workers, they are not vaccinated. They are not vaccinated, and even the community, for those families who have members who are positive, the vaccine is very expensive, and at times it is not even there. So we really need your support. Thank you for the support, but we still need more support for us to allow or to help our community have a success in these objectives. Thank you so much.